We define systems leadership for those leaders who are working across organisational and professional boundaries. So they'll be working across health and social care and the third sector, private sector organisations. So it's a multi-organisational approach.
I guess it's being able to understand the issues that are relevant to all organisations to make sure that collectively you can make the changes that you need to for the health service.
The issues between health and social care currently can only be solved across an organisation and collaborating within communities of practice. Obviously with austerity there's a need to maintain performance and improve it if possible. So all those leaders and all those organisations have to work together.
So I've just taken on a role as Head of Delivery for Sunderland Vanguard programme, which is a new model of out-of-hospital care that involves a range of different partners working in a very different way.
What we do as an organisation ourselves will impact on others, and it's making sure that collectively we understand that before we make changes and implement new ways of working.
Thinking much more broadly about how we allocate finances and resources, how we change the model of care so that we wrap things around patients rather than deliver things in a siloed way.
North East Leadership Academy is always willing to engage with leaders, talk to them, whatever support they require, whether that be an individual level, a team level, organisation or a system level. They can get in contact with us. We offer coaching support. We offer bespoke consultancy services where we can go into the organisation or the community of practice or even the STP to help with some of those issues.
I think I've been very fortunate to benefit from a number of the Academy's interventions, so most recently in terms of the Senior Leader Development course, which very much had a focus around systems leadership and thinking about how I personally work differently in terms of how I interact with people, how I sell a vision, how I look to resolve some of the very difficult and complex problems that are sort of outside of the normal issues that you would face as an NHS manager.
So a strong systems leader would be someone who operates equally as well in high performing status in their organisation and across the system. So they work across the polarity within their organisation and across the organisational boundaries themselves. Of vital importance would be a commitment to a cause, so having a common purpose and an understanding actually why you're undertaking some of the transformation. Negotiating well, negotiating when you're not in managerial control, and a commitment to improvement and transformation.
For leaders across those silos to actually come together as a day, see each other's point of view, realise that actually we're not in competition with each other, we are part of the bigger whole of the NHS, is a very valuable use of time.
So it's not just this year where we can offer support to systems leadership. Last year we did a number of masterclasses with national and international speakers talking about the need for system leadership and some of the practice which goes along with that.
The systems leadership and systems thinking tends to draw the system like an engineering diagram. We tend to draw it like a complex ecology.
We all think we know how the system works, and we very often don't. And I think the big advantage of the systems leadership courses that Neil is running is that it gets us all onto the same page. It gets us to realise that there's been some really good thinking around the world that is now being brought into the North East.
All of the projects that I do are across organisational boundaries. Because I work in clinical networks, our role is to bring together clinicians to look at system-wide problems, so everything I do is across the system.
One of the good things about coming to a day like today is when you're at work, it's very easy just to get subsumed in what you're doing, how you're doing the day-to-day kind of working environment. It's really good to take a step back and realise that what you need to do is constantly understand everything from everyone else's perspective.
It's something that everybody needs to do. It's not down to an individual, and it shouldn't be down to an individual. And the way we direct the system comes from within. It's down to being an ethical, a person with integrity.
I think it's an approach that I'll be promoting with colleagues across both the health sector and the local government sector. It's a different approach, but you do have connection points, and it's been really resonant.
And what we're hoping to see in public sector is people with integrity who are therefore driving systems in directions that actually deliver a public service, deliver a community that I'd like to be a member of.